So good afternoon, folks. This is Andy Reese with the Department on Disability Services. As always, I will start by sharing our data for the week. Except that I don't have permission to share right now. So if someone could give me that permission, as soon as I have permission to share, I will share the data. There we go. So as I indicated last week, we did have 3 people who tested positive for coronavirus in August. We have had no more people this week. That brought our total up by 2 to 431 because one of the 3 people had tested positive in May of 2020 and tested positive again recently. Of the 3 people, 2 of them had been vaccinated, and the person who was testing positive for the second time has not been vaccinated. Among the people who have tested positive, there have been 9 in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 56 in their natural homes, 2 in a nursing home, 4 in out-of-state placements, 37 in residential habilitation placements, and 2 in supported living. And so the 114 people in intermediate care facilities represent about 38% of people in ICFs who have contracted COVID. Of those, 11%, there have been 13 people who have died from confirmed COVID deaths in ICFs. Of the 114 people, there have been 28 total deaths, but as I said, only 13 of those are confirmed as COVID related, accounting for about 11% of people in intermediate care facilities who've contracted COVID and have died. In natural homes, those 56 people represent about 6% of people in natural homes who have contracted COVID. And of those 56, 5 have died, and all 5 are confirmed as COVID deaths, representing about 9% of people in natural homes who contracted COVID and died from COVID. In residential habilitation, the 37 people account for about 34% of people in residential habilitation. And of those 37, there have been 2 confirmed COVID deaths, accounting for a little over 5%. There was 1 additional person who died, but it was not confirmed as a COVID death. Within supported living, the 208 people who have contracted COVID represent about 22% of people in supported living. Of those, there have been 22 deaths, but only 15 are confirmed as COVID deaths, representing about 7%. And so overall, in DDA, the 431 people represent about 18% of the overall DDA population of people supported who have contracted COVID. And of those, the 37 confirmed deaths represent almost 9% of people who have contracted COVID who have gone on to die from COVID. No change from last week in that there were 3 people in supported living who contracted COVID in the month of August. And we have not had anyone who has required inpatient care for COVID since April. We did have someone die this month who had contracted COVID more than a year ago, but that has not been confirmed as a COVID death. And so our total number of COVID deaths is 37. Of those, 16 have been confirmed as not COVID related, and 8, we do not yet have a confirmed cause of death from the Office of the Chief Medical Examiner. And so we have not had a confirmed COVID death since March of 2021. Among provider staff, there were 5 additional provider staff who tested positive for COVID in the past week, bringing that number to 715. 52 of these staff work for more than one provider, and 10 staff have died from COVID. So in terms of vaccination, the people supported by DDA, updated as of yesterday, 76% have received at least one vaccination. That represents 78% in host homes, in ICFs, 98%, in natural homes, 60%, in residential habilitation, 95%, and in supported living, it's at 85%. Amongst provider staff, it was updated, as you may recall, we update this every 2 weeks. It was updated last week, and it was at 63%. And as I had said, you can go to dds.dc.gov and look at our website, and you'll see the details for each provider agency. There's quite a range in terms of the vaccination rate among different provider agencies. DDS staff, as people I believe are aware, all district government employees by September 19th will have to either be vaccinated or demonstrate evidence that they meet one of the exemptions or begin testing weekly. Staff for district government staff have been asked to submit their vaccination status via our personnel portal, and 89% of our staff have reported, which reflects that to date 78% have been vaccinated. I'll just acknowledge that we did receive a letter this week from Quality Trust, University Legal Services, Disability Rights at University Legal Services, and the Developmental Disability Council. The letter was addressed to the mayor, director of DC Health, the deputy mayor for Health and Human Services, who is also the director of the Department of Healthcare Finance, and me, just recommending that the district should, or advocating that the district should require that all DSPs be required to be vaccinated for coronavirus. And as people may be aware, there was communication sent out more than a week ago, I guess. Yeah, more than a week ago. It was a week ago Monday, to all licensed, certified, and registered health professionals in the district, advising them of the requirement to get at least their first shot by September 30th, and advising them that before they could renew any license in the district, they would be required to be vaccinated. And applying this requirement as well to unlicensed staff in licensed facilities in the district. And so this requirement would apply to our ICF and ResHabs in the district, and to any staff, so DSPs who are registered as trained medication employees, this would apply to them. And keeping in mind, just, any mandate that issues from the mayor of the District of Columbia applies to services in the District of Columbia. I think that expanding those requirements into other states is far more challenging. There's a question about whether we know if the 5 staff who tested positive this week were vaccinated. I know that it was a mix. I heard a noise. Maybe someone else was going to answer with the specifics there. So we, just so people know, like for the for the people we support, we track that when we look that issue up when the reports are made. It is not one of the columns in our sheet that we are currently tracking, but we are able to look it up for each person. And so, and when providers report their numbers in terms of vaccination status to us, they're reporting aggregate numbers. They're not reporting staff names. DC Health would work with each of the providers and address the issue of whether they were vaccinated or not, to the extent that's. There's a question, did the 5 staff work for multiple providers? No, they did not. Oh, okay. Very happy to report that we have DC Health with us today, and I see someone has a few questions for DC Health. So, is there updated guidance from DC Health regarding whether or not an employee needs to quarantine due to COVID exposure if they are fully vaccinated? And I know that Nelson and Daryl are both with us.
Director Reese, I think Daryl actually had to step off for an emergency. We have some guidance that should be released soon, I hope, that will address that question. But I can tell you that the new guidance will say that fully vaccinated individuals, healthcare providers in particular that are exposed, do not need to be restricted from work, but they will have to be tested immediately and then 5 to 7 days after exposure will be the new guidance for healthcare employees. And then I'm hoping that should be posted by next week, but as some of you may or may not be aware, with the passing of our epidemiologist, our senior epidemiologist, Dr. Davies Cole, and some changes in leadership, it's kind of put some of our approval processes in a little bit of turmoil. And we're working to get guidances approved and posted as soon as we can, given the circumstances. So we do ask for patience. But that is a recommendation that's consistent with the CDC, and you certainly do not need to wait until that guidance is posted to start testing fully vaccinated employees that are exposed under that guidance. It is consistent with current CDC recommendations.
And their second question is, and Karen Stringfield is no longer with DC Health or joining us on these calls. She would have been the one to answer this question. Is there a plan for people we support to be prioritized for 3rd doses / booster shots of the COVID vaccine? We're being asked by guardians and people we support if there's any plan in place for booster distribution. First of all, 3rd shots have been recommended for people with immune deficiency. And so when there's questions about whether that applies, a person to whom that applies would be a person who is currently getting health care from someone. And so anyone who has questions about whether that applies to them should be asking their healthcare provider about whether they are someone who needs the 3rd shot in order to increase their resistance immunity from the COVID-19. Booster shots, we have heard conversation about those being administered. Is it 8 months after the second shot? I haven't yet seen that is a recommendation that the CDC has put out, although there's been a lot of discussion about it. The thing I would just remind people of is what a different place we are in today than we were in December, January, and even early February in terms of vaccine availability. So it was very important in December and January to have clinics so that our folks could go somewhere and get their vaccine. Vaccines are readily available in some doctor's offices, at CVS. I don't anticipate that there's going to be a need to have the kinds of clinics that we had previously. Providers, like they provide for all other healthcare for a person, should be able to arrange for vaccination for people without much trouble. There is also reference on DC Health's website, on the coronavirus.dc.gov website, for people who need a vaccine administered at their home to make those arrangements for people who can't get out. But no, I don't see us arranging clinics this time because it doesn't seem to me that there should be a need. Our biggest challenge now is not the availability of vaccine, it's the 40% of people who are in natural homes who haven't gotten one yet. And the 37% of staff who haven't gotten one yet. So, our focus really is on getting those people to the vaccine. It's on really, identifying what the barriers or the reluctance is to get the vaccine and addressing those things. But I don't see that there's any issues with availability of that healthcare in the community. For DC Health, will that guidance you just shared regarding testing after exposure apply to all DSPs across settings?
It applies to all healthcare settings. So, and I will defer to Director Reese on how that applies to DSPs.
So supported living is not a healthcare setting, so that people are aware of that. Thank you. So Winslow has provided the information regarding the 5 staff. 3 were unvaccinated, 1 was partially vaccinated, and 1, the provider had not given that information. Oh, and someone has posted here in the chat. Please note, since April, DC Health has provided homebound residents with the option of calling a number to get vaccine administered to them at home. And it says, but now the program is available to all residents who want the vaccine. And there's a link here in the chat for people who would like to click on that link. I will also say, having worked with someone having worked with someone who was in Montgomery County trying to get tested after they had an exposure and were feeling ill, the district is doing a really amazing job at testing as well in terms of availability. It was very challenging in a neighboring jurisdiction to find a place where this person could get tested close to home. And in DC, we have the places at a variety of different public libraries. You can pick up a self-test and drop it off the same day. We still have our firehouses at some locations. Coronavirus.dc.gov has the list of all the different places each day where you can get a test. And those are available each day. Someone is asking, is DDS saying that DC Health's upcoming guidance? Let me just stop right there and say, once we see DC Health's guidance, then we will tell you what it says. So I'm not going to provide an interpretation of the meaning of guidance that I haven't read yet. If someone says that it applies to healthcare settings, I don't think that anyone wants to call the apartments that people we support live in a healthcare setting. However, I will defer before making any comment on that, any further comment on that, until I have read whatever guidance it is.
Thank you, Director Reese. Yeah, you should continue to follow the current posted guidance until the new guidance is posted.
And each time that we had, just so that people are aware, any time that we have a report of a staff COVID infection, we are coordinating with DC Health to make sure the necessary steps are taken to ensure the health of the people that they support. There's a question, wouldn't people also want to follow CDC guidance for everyone? I mean, I can let DC Health take that. I think that DC Health looks at CDC guidance when they develop the DC Health guidance. But each of our providers, those that provide health services, at least one would hope that they're staying current with CDC and well, I would hope all of our providers are staying current with DC Health and CDC guidance. And I think they stay mostly consistent, but you could comment on that, Nelson. I don't know that there's differences.
For the most part, we are usually consistent with CDC guidance. There are instances depending on local, the local picture, local levels of community spread that we at DC Health might recommend something that is stricter than CDC guidance. But in this case, we are in line with CDC guidance.
And for staff that are infected with COVID-19, is contact tracing done? Yes. I mean, I can let DC Health answer that, but if you look at the coronavirus website, you will see the references to contact tracing that is done in the district. In addition, we meet bi-weekly now. We used to meet weekly with DC Health to look at every case where there's been a report of coronavirus, either by staff or a person we support. I see a comment. We are now seeing new cases appearing in supported living, yet staff vaccination is not required. With the new staff vaccination requirement for ICFs and ResHabs, it becomes more likely that providers will shift unvaccinated staff away from ICFs and ResHabs into other settings where people's vaccination rates are already lower. This is going to place people at greater risk. Just to comment on that in particular, so, prior to these 3 cases in August, we had not had a case since May. And of the 3 cases in August, there were 2 people, both vaccinated, contracted COVID from a staff person, I believe, also vaccinated. And so, yes, we saw 3 cases of people in supported living, but 2 people lived in the same home. Both of them had been vaccinated and both of them contracted COVID. And so, unfortunately, we do have some breakthrough cases of COVID. But certainly, vaccination for all staff is something that we would like to see happen. And it seems to me that the kind of circumstance you're describing here would be pretty challenging in terms of staffing for agencies to track who's vaccinated, who isn't, who can work where, and not work where. And keeping in mind, as I said, for agencies that have supported living placements in Maryland, this doesn't apply to them, or reshabs in Maryland. They would have to follow whatever the rules are in Maryland. But what we are seeing so far is that the rules within agencies apply to all of their, apply equally to their staff. So where we've had agencies that are beginning to impose mandates or have imposed mandates, they've imposed them pretty much across the board. Just a comment, I don't see that explanation as a justification for a lack of a vaccine requirement in all settings. Well, that's why at the end I was saying I absolutely am not disagreeing with anyone that all staff, including all DDS staff, should be vaccinated. It's the reason that the mayor has imposed that on all of the people who work in the District of Columbia. I was just pointing out that the example of saying that people in supported living are now getting coronavirus doesn't exactly make the case, but it doesn't mean that we don't support the fact that all staff, other than those who have a health reason or people who have a religious objection, should be getting vaccinated. How many provider agencies have imposed a vaccine requirement? I don't know. And prior to getting the question, I'll answer one that I anticipate, which is, as people may recall, as part of our ARPA, the American Rescue Plan Act, funding request, we have included incentives for provider staff to get vaccinated. Our ARPA plan was submitted to the Centers for Medicare and Medicaid Services on July the 12th. And they had said that we would get a response within 30 days, which has now been redefined to be 30-ish days. And we have still not gotten a response to our plan. So as soon as we get that response, we will then know, how quickly we can be able to put into place that incentive. As I said, we really hope that people are also doing education. I know that our providers have been doing that in an ongoing way, because they'll want to take advantage of the incentives, as well as when we get to the point that there are mandates across the board, people will be much better prepared for it. someone posted a reminder before, if you're typing in a question, please make sure that you type it to everyone, because when you first pull up the screen, what shows up is all attendees. And if you send it to all attendees, then we won't see it. Everyone is down at the bottom. There's a question about the Appendix K. Does it refer to increase on just positive COVID cases, quarantined cases, and overtime? I'm not understanding that question. We did do a review of the Appendix K last week.
So I believe the question is asking whether we increase the rates for services in the Appendix K. And the initial Appendix K did increase rates, and there are increased rates for cases that were quarantined, and there is a ability to receive overtime for quarantine cases. The guidance is pretty specific. I can share with you that in my experience, some providers didn't fully understand and believed that they could be paid through the enhanced rate from DHCF and sought us, meaning DDA, to have them paid again overtime. And I'm sure that was an error. But the rates were increased, and quarantine rates were also enhanced from that initial increase. And there is a process for providers to be reimbursed for overtime in excess of what the current rate pays for. So I would encourage people.
Everything you're describing has been in place since our initial Appendix K. There's been no change, right?
I have learned not to assume that people understood what we did over a year ago.
I get that, but I'm just saying that the most recent amendment to the Appendix K did not amend anything about quarantine rates.
Correct.
So if you have questions, you could contact either your contract administrator or Winslow, who then has to review what gets submitted after the contract administrators receive it. And you could contact them before you put things together so that you're sure that you're compiling, whatever is necessary, so that you don't go to all that work and have to redo it once it's been submitted. And I haven't heard him do it often recently, but just as a reminder, 202-730-1618 is Winslow's number. Oh, and there it is right there. So he's put that in the chat. Okay, well, I don't see any additional questions. Seems that we've gotten to every question people had for right now. As I said last week, the issue, and I know the many questions relating to vaccines and mandates, that is an issue that as the facts change, we see that ever evolving. We have seen, just over the last few weeks, district government employees being required to get vaccinated, licensed healthcare providers. So, as I said, the most important thing is to be educating people about the importance of the vaccine, about sort of how safe and effective it has proven to be. Even with the breakthrough cases we've seen, we haven't seen people seriously ill. As I said before, we haven't had anyone in the hospital since April. And so, the real importance of encouraging all staff and everyone we support to get vaccinated so that we can truly, finally move past this. So with that, if we have no other questions, then everyone have a nice weekend, and we will talk to you again next week.